All right, so following up today on this interesting case of nail dystrophy. And so just a reminder, this is kind of a split screen of two of the same photos of this patient with nail dystrophy. Here you see lunar hypertrophy, yellow, kind of greenish discoloration, and then a linear brown streak, and then kind of an under the nail en face appearance shows subungual hyperkeratosis. So this clinical constellation is compatible with onychopapilloma. So I haven't done a biopsy of this patient yet, but usually when you see these findings, which indicate both matrical and nail bed disease, it's consistent with the onychopapilloma. So you know there's matrical disease because there's lunar hypertrophy. You see that there's a longitudinal streak here, so the nail plate has been damaged, and then there's this discoloration here, probably indicating some subungual debris. And then when you see the subungual debris from an en face appearance, that tells you that there's nail bed disease. So this hyperkeratosis is because there's a nail bed problem. Onychopapilloma unites those findings beautifully because it's a tumor that occurs at the distal aspect of the nail matrix, where the nail bed comes off of the nail matrix. So normally your lunula goes to about here, and you transition from the matrix here to the nail bed here. And so you get a formation of a tumor pretty much at the junction of that, which then sits on the nail matrix, causing all these distal changes that you see here, as well as a lunar hypertrophy. And then eventually the nail bed gets disrupted and you get the subungual debris. And that's all compatible with the onychopapilloma. Usually you can make the diagnosis just by avulsing the nail plate, which will show this subungual papillomatosis. But I always do a small matrical biopsy as well, or a nail bed biopsy up here as well to show that diagnosis. Treatment is with surgical excision. Usually what I do is you see where the nail plate is dystrophic here, from about here to here, avulse that part of the nail, look underneath the nail and see if you see any obvious nail bed tumor. You usually see kind of this kind of tan to brown friable plaque, and then excise it. So it's an onychopapilloma. The main thing that would be in your differential diagnosis would be an onychomatrixoma or onychomatrixoma, but that's different. That's a pure matrical tumor that's back here. And usually what that's going to present with, and you can look this up because I don't have one on hand right now, is with this lateral dystrophy. Obviously it's not blue, but you see this lateral plate dystrophy that usually looks yellow, sometimes green or tan, and it's a lateral plate dystrophy. And when you look on FOSS here, instead of seeing subungual hyperkeratosis, you see a kind of like a honeycombing or moth-eaten appearance. And look that up to see the onychomatrixoma, how it looks different in that it's lateral, it's more destructive, and how the en face subungual appearance looks different. So this is an onychopapilloma.